We're in clinic this morning with Kirsty, who's having her procedure in 3 weeks' time, a breast augmentation. Now, this is one of the most important parts of our consultations within Aurora, and it's the sizing appointment. So Kirsty has brought some tops in to me today. She's brought, most importantly, some photos of breasts that she really does like the look of. So it gives me an idea of what the patient's trying to get out of this surgery. Obviously, I will advise if I think she's off the mark, and obviously there are limits for what Mr. Richards can actually put into patients. So we've taken measurements from here, the base width, we've looked at the height, and we've looked at the actual amount of tissue covering the top part where the implant will sit. Now, Kirsty is very close to being a dual plane position implant, but she could go in front. She does have 4 centimetres of breast tissue, so we could actually put the implant in front of the muscle. But she's done a lot of research, and I think we're going down the route of the dual plane, aren't we? Yeah. Okay. Now, obviously, I've seen the photos that Kirsty likes. She is looking for quite a full breast. She's currently an A cup, aren't you? So we want something that looks fairly full. If we are going behind the muscle does tend to flatten the top of the implant. So we are looking at a high projection implant. So I'll show you that in just a sec. We're sizing today with a Nagor implant. Nagor are British implants made in Glasgow. And we're looking at the high projection, and I'm going to start Kirsty off with about 360cc implant, which should give her, with this size, approximately a D cup. Obviously, every manufacturer sizes differently, so from the sizing appointment, it's important for the patient to say, that's how I want to look, as opposed to the cup size. As I say, every manufacturer measures differently. You go into Debenhams, Marks and Spencer's, House of Fraser, they all size differently. So it's very much how the image the patient sees in clinic that we can actually sort of, say, we don't know what the cup size will be, but it's what you like. Okay? So little dot into the bra and onto your nipple. Okay. Now, do you mind if I just have a quick? Quite often these don't sit quite right, so I always like to try and move them into the bra. I'm just sizing with a sports bra actually, but these are actually really quite nice bras, and quite often our patients use these as an alternative to the surgical bra post-surgery. Okay, so if you just stand up for me a second time. Now, Kirsty isn't very tall, but she's making me feel tall, and I'm not very tall. So what we don't want is this breast augmentation to make her look chubby or mumsy, because that's the other thing a lot of girls are worried about. They want to be in proportion, so they have a nice shape, and if we look from front on, we can now see Kirsty's breasts are in line with her hips, so you can see she's got a beautiful little waist. What we don't want is that her bust is then bigger than her hips, or she will look chubby because she's short. Okay, so we're going to try a t-shirt on with that now. Have you got a t-shirt for me? The other thing that I actually ask all our patients to bring is a white t-shirt. Now, black, if you put black on with anything, black minimises the size of the implant. So the white will actually show these implants probably at their maximum size, really. I just have to put a t-shirt on, somebody videoing you, isn't it? Now, obviously from the sizing, we can actually get a fair idea of the size. Now, the sizes do come up slightly smaller when they're inside, but what you can't see from the sizing is the actual impact the implant will have on this top area of the bust. But size-wise, I do actually think that's really nice, isn't it?
I can feel the difference.
Yeah. Do you want to have a quick look in the mirror?
That's a big difference, isn't there? Yeah, I like that.
You like that?
I like that. What do you think?
Kirsty's partner is actually videoing this sizing, and he's got a big smile on his face. Now, what I will do, Kirsty, obviously we'll try the next size up to see how that looks, and then we've narrowed it down really to the two sizes, really. Obviously, you know, I do a lot of sizing, so I can sort of size, sort of almost from looking from the pictures, patient's physique, you know, things that will actually look nice, implants will look nice in patients, and obviously I assist Mr. Richards in theatre, so I'll be following Kirsty all the way through this procedure. Okay, we'll just try the next size up, so we'll take those out a second. Now that looks nice, but it's, I would say that would be our maximum, and that's the 390 high projection.
You're not smiling as much as these ones.
You can sort of see they're sort of going over really, size-wise. Have a little look in the mirror, Kirsty, and see what you think.
That's too big, I think.
Yeah. I think what we'll probably do in theatre, now you've watched Mr. Richards do the procedure, haven't you?
Yeah.
When we're actually in theatre, we tend to use like an empty bag. Yes, sit down there. We use an empty bag, and basically we fill this up with saline in theatre when we actually make the pocket. So when we make the pocket for the implant to sit in, we put a trial implant in, we blow it up and we sit you up to look to see which size will look the best. So we'll go to the first implant size, then to the second implant size, and then Mr. Richards will make the final decision. Okay? With the rest of the team, I hasten to add.
Yes.
Okay? So we've decided properly between the two sizes, because this will come up smaller but bigger than the last one.
Right.
Smaller than this but bigger than the last one.
Yeah.
So it's a very in-between size. So I think we've narrowed down to the two sizes, the 360 and the 390. Now what I'm going to do now is talk Kirsty through coming to hospital while she's sitting with the implants on, because I think it's quite nice to actually have a feel for the weight of the implants while we talk about the actual procedure itself. Okay? Yeah. How do you feel about it? Do you want to try a different top on with that? Yeah, try some different tops on. I've actually had wedding dresses and ball gowns and all sorts in here, so
I try to kind of sort of all aspects from this one. It's rather warm.
okay.
Because
You do like the look of it?
when this falls down,
Yeah.
I fall out.
Yeah.
It's nothing there to hold it up.
I do actually have a lot of girls bring clothes in that they've bought but won't wear when they come for a sizing. So you sort of, a lot of girls will buy lots of clothes, get them at home and think, oh, you can't wear that, and it just sort of stays in the wardrobe. How does it feel weight-wise, Kirsty?
They're a lot lighter than I thought they'd be.
Yeah.
I was expecting it to be a lot heavier.
Yeah. I think you can just do it with that one, can't you? Do you have a little look in the mirror?
It's a lot better. What do you think? It's not so gappy now. It definitely works.
Yeah.
They look smaller in it, but
Because of the black. Can you see
Yeah.
how the
Yeah.
size changes with the black t-shirt?
yeah.
So that's why we also bring a white t-shirt, because that looks very different now, doesn't it? Have a little sit down, darling. Now you're all right holding that while I talk about the rest of the next bit. Yeah. You haven't got achy arms or anything. No. Perfect. You've got very obliging partner. So basically, morning of the op, you're coming into Three Shires Hospital. So have you been given a time to come in yet?
Yeah. I think it's cool.
So at 7:15 you'll come into the hospital. Now that means you're going to be somewhere on our morning list, so it means that you're starved from midnight. So nothing to eat, drink, chew or suck from midnight. Now that includes water, polar mints and chewing gum. I've actually walked into patients' room and they're eating chewing gum, and I don't think they're eating, but it does stimulate gastric juices, so not even any chewing gum. You can, however, brush your teeth out as long as you spill out properly on the day. Now the other thing that's very important, and it goes out on all our paperwork, is that on the morning of the op you have no body moisturiser on whatsoever. You can moisturise your face unless you're a facelift patient, of course, but nothing anywhere else from the neck down. So if you're showering the night before, make sure you go to bed with a squeaky clean skin, no moisturiser. The theatre staff use a lot of equipment that we need to stick physically onto your skin, on your chest, on your legs, and we need your skin to be totally clear and clean. Okay? So you'll come into the hospital. 2 weeks prior to your surgery, you'll be coming for a pre-op assessment. I think yours is next week, isn't it? At the pre-op assessment, the girls take blood tests. They swab you for MRSA, which is the superbug. Now, we don't cancel surgery if that is a positive, but we do actually treat you prior to the surgery if it does come back as positive. So you'll have body washes, antibiotics, etc. to take before the op. Okay? With the pre-op assessment, if everything is clear, you will come in as planned on the day of the surgery. If at the pre-op assessment something is picked up, urine infection, something not quite right with your blood test, then inform our clinic, we'll inform you, and then we'll investigate, retest them. If they're still not quite right, then you will be referred back to your GP and we'll reschedule the surgery. I have to say, this is a very rare thing to happen, but it's nothing for you to worry about, okay? But all being well on the day, you'll come into the hospital. The pre-op assessment at Three Shines is downstairs, the ward is upstairs. Okay, and when I say ward, there are 3 wards, but each ward has its individual room, so you'll be in your own private room, ensuite, TV, telephone, etc. Okay, on the morning of the op, the girls will take you into your room. I assist Mr. Richards at Three Shines, so I'll come in first, get you ready for Mr. Richards to come in. Mr. Richards will come in, you will sign 2 consents. Now the first consent you should have either received a handwritten copy, or our other office actually do a email of that consent, and that's basically your signing and you know the risks of the surgery. On the day of the surgery, if there's anything you want to go through with Mr. Richards from that consent, you can actually discuss it with him. But it's just that we don't like to present you with his copy of the consent and you not have seen it. So you will see it quite a bit in advance. I think you've already got it, haven't you, Kirsty? Yeah. The other consent is a Three Shines consent, which is a very condensed version of our consent. Okay, so once those are signed, we'll sit you on the edge of the bed. Obviously the gown will be undone and we will actually draw on your bust. Okay, now I have to say the markings are a guide for Mr. Richards. I've actually been called out of theatre because patients have been panicking, they're having flying saucers put in, because he does tend to mark all the way around here. Your bust isn't going to be all the way up here, but he will mark, he'll measure where his scar's going to be, and he'll measure the distance from the nipple to the fold to make sure that the bust is even on both sides. So we do all that all sitting up. Once Mr. Richards has been to see you, you will then be seen by the anaesthetist. Now the anaesthetist will listen to your chest, go through any medical issues you have. Obviously, if there's anything more serious, and you're very fit and healthy, Kirsty, so you wouldn't have seen them at the pre-op assessment, but quite often if the girls have got any sort of underlying conditions, diabetes, anything like that, thyroids, they see the anaesthetist prior to the surgery. Okay, but on the day the anaesthetist will come in, check you out. Now if you come into the hospital and you're unwell, you have a temperature, you're coughing up green horrible mucus, not well in yourself, we will postpone the op. Because this isn't an emergency procedure, it's elective, we're choosing to do it, you have to be 110% well. Obviously there are risks of surgery anyway, and we need to know that you're well enough to go through this because you're choosing to do it. Okay? After the anaesthetist has been, you'll be taken down to theatre. You'll go into the anaesthetic room. Now because you are at Three Shines, I will follow you all the way through, so I'll come into the anaesthetic room with you. You'll go off to sleep and then you'll go into theatre. You will then wake up an hour or so later wearing a sexy surgical bra. Okay? So obviously you'll wake up an hour or so later and you'll be wearing a surgical bra. Now this is the sort of style of surgical bras. They all vary slightly and we use 2 varieties. They do up at the front and they have adjusting straps at the top. Now the only thing covering your surgical scar incision, which is between 4 and 5 centimetres, so quite a tiny incision that'll be under here, will be this brown tape. Okay, so the other thing I'm going to get you to do for me today is to pop a little bit of this on, and I want you to keep it on for 24 hours. Okay, keep this on for 24 hours. Have a little wash in it tonight, because you'll be wearing this up to 6 weeks. And if you have any reaction to that in the first 24 hours, we can use an alternative, but it doesn't stick quite the same. So that is basically your dressing. Okay, that is your surgical dressing, and that's how you wake up. Now, if we go behind the muscle with you, Kirsty, you'll wake up and you'll feel as if somebody's sitting on your chest. And that's what most ladies say to me when they wake up. They feel as if somebody's sitting on the chest. Quite often they feel a little bit panicky, breathing-wise. But that does wear off, and you have lots of painkillers on board as well. But it's quite a sort of a pressure feeling. We had 2 ladies last week. They were behind the muscle, and they both woke up with back exactly the same sort of feeling. So it is a sort of a pressure feeling, but it will wear off. Okay, so it's just you not panicking, and obviously you'll wake up with the theatre recovery team, and they will talk you through breathing slowly and everything else. Okay, okay. So you'll wake up with this dressing. Now you will then go up to the ward where you'll have your post-op painkillers. We put lots of local anaesthetic in during the surgery, and that will last up to about 6 hours. Okay, so you should be fairly pain-free, but it is this sensation of feeling a bit squashed when you wake up. Obviously the implants sit quite high, so you'll be you'll sort of look down and see these implants, but they will gradually drop as obviously time goes on. The first sort of couple of weeks are them settling. And then a lot of girls use the term of fluffing. So it's a bit like fluffing a cushion actually, so they will actually go into where they want to be. Okay? So you go back up to the ward, you have your painkillers. Most girls, if they have their surgery in the morning, they're eating and drinking by mid-afternoon. Okay? The next morning you will go home. You go home with your painkillers, you'll have a follow-up appointment for 1 week's time. You'll also have post-op advice. Okay? Now, this dressing stays on and it stays dry for a whole week. So it'll be a case of shallow bath, flannel wash at the sink, and you can use a roll-on deodorant. Okay? Sprays go everywhere, but we do say you can use a roll-on deodorant. It's bad enough sitting in the bra all week without having to use deodorant. Okay? So you come back at 1 week post-surgery. Now, Mr. Richards uses 2 methods, skin methods of closing. So you may have some little stitches that may need trimming, or you may not, and it might just be a wound check. Okay, so we'll advise the nurses in outpatients which method we've used on the notes. Okay, so after your wound check, all the stitches are dissolvable, so they will eventually dissolve on their own. But the girls in outpatients will take the dressing off, clean everything, and then they'll put more tape on, and then it's down to you guys to change every 3 to 4 days. Okay. But from that point you can start showering, which sounds a bit weird, you're showering with tape on. You can also leave the bra for an hour each night. Okay, that's your naked hour where you can sit looking at your boobs in the mirror.
So that's a week.
Okay, that's a 1 week post-surgery. So the first week is quite hard because you are recovering from your surgery, lifting your arms and things may be a little bit painful. So every day you will get better. So your first day is going to be your worst day, and each day will get better. Okay, and obviously if you've got any concerns, you phone the hospital or you can phone me direct. Okay, so we use the surgical bras and surgical tape up to 6 weeks. After the 6 weeks, you will come back to see Mr. Richards. Obviously, any worries in the interim, please phone. You never wait. I've got an appointment in 4 weeks' time. I'll come back then. If you're worried about anything, you can phone up. Okay, and then 6 weeks. We stop using the surgical tape and we go on to scar treatments or bio-oil, vitamin E cream, whatever you want to use on that scar basically. The massage will help break down the scar tissue. So initially at 6 weeks the scars feel a little bit lumpy. The massage will help get rid of that scar tissue. Okay? You can then also introduce your underwire bras. But what we do say is you do it very gradually. So by the 3-month mark you should be treating these boobs like yours. Okay, so everything's done, and obviously going back to gyms and things, you could do lower legs at about 4 weeks, but obviously no jogging, no cross trainers, no upper body type stuff, till you see us at 6 weeks.
What about swimming?
Swimming?
We do hydrotherapy, so though I don't,
You could swim at about 4 weeks. About 4 weeks, but you would actually go in with your tape on, take fresh tape to change, because swimming pools are notoriously dirty, and it's just an extra protection for you then. But about 4 weeks you go back into swimming pools. Okay. Any other questions, please?
I've read a lot of people who sit up,
Yeah.
sleeper, position.
Yeah.
Is that?
I would actually say in your first week you probably will need an extra pillow. You don't sleep on your front at all, do you?
I kind of sleep in that
On your sort of side, on your side. Well, what I would actually do is have pillows down each side, so at least your breasts aren't resting directly on the mattress, they're actually on a pillow. Your body will probably wake you up if you're doing any harm. Okay, so always through the whole procedure, let your body be your guide. If you're doing something and it's hurting, you need to stop doing it. And that includes everything. What I will say to you is leaving the hospital, because you are going to be behind the muscle, is that you wear some sort of zippy type top or a button down blouse or t-shirt or something that you can actually undo, rather than something you pull over your head. Wash your hair before you come in the night before, because that's the other thing, with not showering, it'll be awkward in your next week unless you go to the hairdressers and sit back and have your hair done. Okay, it's an extra treat anyway. Okay, as I say, we see all our patients every year, and obviously any concerns in between them, you just pick the phone up.